Welcome, I am Serenity Howard, and today we'll be exploring major depressive disorder and potential treatment options focusing on antidepressants. Major depressive disorder, MDD or depression, is the second highest cause of disability in the world. Depression is due to stress, disease, and physical trauma. MDD is a mental disorder that impacts how an individual thinks, feels, acts, and perceives the world around them. Symptoms include feelings of guilt, worthlessness, irritability, hopelessness, emptiness, sadness, thoughts of suicide, low energy and mood, and a loss of interest in one's like activities. Additional cognitive concerns linked to depression include difficulty concentrating, remembering information, and making minor decisions. Other symptoms are slowed speech and movement, repetition of purposeless activities, and changes in sleeping patterns and appetite. In order to be diagnosed with MDD, the noted symptoms must be present for most of the day, almost every day, for more than 2 weeks. Additionally, symptoms must impact day-to-day functioning. There are numerous neurotransmitters involved in depression. The first neurotransmitter is serotonin, which plays a role in appetite, sleep, circadian rhythm, emotions, aggression, pain sensitivity, sexual behavior, thermoregulation, and sensory motor reactivity. Serotonin abnormalities include reduced serotonin concentrations, altered serotonin receptor binding, impaired uptake function of the serotonin transporter, decreased availability of the serotonin 1A receptor, and increased availability of the enzyme that metabolizes serotonin. The second neurotransmitter is norepinephrine, which plays a role in cognition, emotion, appetite, levels of pleasure, pain response, aggression, and sexual pleasure. Research indicates that individuals with depression often exhibit lower levels of NE. The third neurotransmitter is dopamine, which plays a role in motivational arousal, reward prediction, and responsiveness to conditional stimuli. Abnormalities include lower DA transporter binding, increased D2 receptor binding, and elevated D2/3 receptor binding in the basal and central nuclei of the amygdala. Glutamate and GABA are the last two neurotransmitters involved. Glutamate is a major and excitatory neurotransmitter in the nervous system that supports cognition, memory, and mood regulation, while GABA is an inhibitory transmitter that produces a calming effect. Research indicates GABA and glutamate transmission is altered. Glutamate system dysfunction occurs, including a reduction of glutamate and low levels of GABA in the plasma, and cerebral fluid occurs. All of these abnormalities are linked to symptoms of depression. Antidepressants are prescription medications that can be used to treat MDD. There are numerous first and second generation antidepressants. Today we will focus on commonly used second generation antidepressants. Selective serotonin reuptake inhibitors, or SSRIs, are the most widely prescribed antidepressant and are usually the first line of treatment. SSRIs inhibit the serotonin transporter at the presynaptic axon terminal, block reuptake, and enhance and prolong serotonin neurotransmission, ultimately increasing the amount of serotonin in the synaptic cleft. Remission rate is about 41.9%. Serotonin norepinephrine reuptake inhibitors, or SNRIs, are often used for patients suffering from pain and depression. They block presynaptic reuptake of norepinephrine and serotonin in the synapse and increase postsynaptic receptor stimulation. This increases serotonin and NE in the synaptic cleft. Remission rate is about 48.5%. Norepinephrine and dopamine reuptake inhibitors, or NDRIs, are typically used when patients experience sexual dysfunction due to SSRIs and SNRIs. NDRIs block the reuptake of dopamine and norepinephrine and increase levels of dopamine and norepinephrine. There are numerous benefits and risks to taking these antidepressants. Benefits for all of the drugs is treatment of depression. Benefits of SSRIs are they have significantly fewer side effects than first-generation antidepressants. Suicidal risk lessens in adults, and they are non-fatal in overdose. Risks and side effects include sexual dysfunction, serotonin syndrome, discontinuation syndrome, enhanced suicidal ideations and behavior in children and adolescents, sleep disturbances, and lack of apathy and motivation. Additional potential physiological symptoms include, but are not limited to, gastrointestinal distress, headache, nausea, lethargy, cramping, seizures, and coma. Benefits of SNRIs are they are more effective than SSRIs and help reduce chronic pain. Risks and potential side effects are similar to SSRIs. They include sexual dysfunction, hypertension, discontinuation syndrome, and sleep disturbances. Other possible physiological symptoms include bone resorption, dry mouth, excessive sweating, nausea, and headaches. One can overdose, as lethal doses are around 2,000 milligrams per day. NDRIs are often used when patients develop sexual dysfunction due to SSRIs and SNRIs. Benefits of NDRIs include low rates of sexual dysfunction, reduced fatigue, pro-cognitive effects, and weight loss. Risks and potential side effects include anxiety, restlessness, insomnia, tremors, dependency, and seizures when one exceeds 450 milligrams per day. NDRIs had the potential for overdose, however, 17,000 reported overdoses in 2002 and only 8 resulted in death. Although antidepressants come with many risks, individuals also run risk by not medicating. 850,000 people die each year from MDD worldwide, and it accounts for 87% of all completed suicides. There is a possibility for recovery without treatment. Spontaneous recovery occurs in 53% of untreated patients within 12 months. The natural course of depression varies. Untreated episodes can last from 6 to 12 months, and in extreme cases, over a year. 2/3 of patients with MDD contemplate suicide. Recurrence of MDD is 50% after the first episode, 70% after the second, and 90% after the third. Additionally, 5 to 10% of individuals will develop bipolar disorder. When individuals suffer from MDD, as well as other psychiatric diseases, personality disorders, and have advanced age, there's a higher risk of death. Antidepressants are not the only possible treatment of MDD. Other possible treatments include psychotherapy, such as interpersonal therapy, cognitive behavioral therapy, and psychodynamic therapy. Other treatments are electroconvulsive therapy, transcranial magnetic stimulation, vagus nerve stimulation, and esketamine. Some treatments can be combined with antidepressants for best results. ChatGPT was thorough when considering a diagnosis for depression. Chat considered prior comprehensive assessments, initial treatment options such as various types of antidepressants, and psychotherapy options. Additionally, second-line options were considered if initial treatments failed, which included medication adjustments and ECT. Chat also considered possible lifestyle factor modifications and other supportive therapies and treatments for comorbid considerations. When comparing Chat and course materials, Chat was more thorough and well-rounded as it mentioned considerations such as comprehensive assessments, various lifestyle factors, and various psychotherapies. The course material went into further detail regarding pharmacodynamics and pharmacokinetics of antidepressants. I would obviously never solely rely on AI for treatment rather than a medical professional. Some reasons include AI's risk of misdiagnosing as it lacks information such as medical and family history, it leaves the potential for overlapping conditions, and it may overlook treatment resistance and individual preferences. Additionally, AI is unable to monitor progress and manage side effects throughout treatment. Most importantly, there is no way to obtain the treatment as AI cannot prescribe drugs nor provide therapy. Using AI safely regarding medical questions is to use it as the first stepping stone and for additional research. For example, one can use AI to identify which type of medical professional can help with concerns. Additionally, AI can help identify potential treatment options to run by a medical professional. Thank you for joining me on this deep dive of MDD.